What's going on, everyone? This is Data Report from datareport.info with this update on some breaking news that just came in after our pandemic update video. Some bad news, actually. Biden to end the COVID-19 emergency declaration on May 11th. Unfortunately, on the same day he releases today, there was a study out on children stating it's now one of the top leading causes of death in kids. I don't know if Biden saw that before he made this decision. Biden recently said he doesn't even think about the pandemic anymore. And I guess in lieu of that, he said, you know what? It's not even a thought in my mind. Why don't we just end the emergency? But does the data really support him doing that? Well, let's see. So first off, what happens when COVID-19 emergency declaration ends? Coverage costs, payments for COVID-19 testing, treatments, and vaccines? Yeah, government's not going to pay for that anymore. You will pay for Paxlovid out of pocket. I'm not even sure your insurance will cover that anymore. Testing? You'll have to pay for testing. And those at-home tests that you get mailed in from the government, that's not going to happen anymore. Medicaid coverage and federal match rates. You'll be paying full cost for that. Telehealth? You might not see as much telehealth. I believe some doctors' offices and whatnot, they were probably getting extra money to do the technology for that. So that may not happen as much. Other Medicaid and CHIP flexibilities, other Medicare payment and coverage flexibilities, other private insurance coverage flexibilities. Yeah, that's going to end. Access to medical countermeasures, vaccines, tests, and treatments through FDA emergency use authorization. Yep, you'll be paying for your own vaccine. These vaccine companies do not want to be friendly about that either. It's going to be between $110 and $130 for the Pfizer or the Moderna vaccine. I have not heard what it's going to cost for Novavax. Liability immunity to administer medical countermeasures. Like mask mandates to slow down the spread and all that stuff. Yeah, probably not going to see that anymore. Even without them ending this, I doubt any city would probably do mask mandate at this point in the ballgame. But yeah, this is not good. So how about that study with the kids? Eh? Yeah, there was a study about the leading causes of death in kids. Take a look at this. It's COVID. COVID's one of the top 10 now. In fact, it ranks number 8. Even back in 2020, when we were told kids do not die of coronavirus, there were some kids dying of coronavirus. April 2020, 20 kids died. Then 21 the next month. Then 17, then 29, and so on. Look what happened from about midsummer on all the way through to January from 2021 summer going into 2022. It started with Delta, then Omicron BA.1. Yeah, you had a good number of kids dying of COVID. Again, remember, they said it was not severe in kids. And even up to now, you still have kids dying of COVID. Not as many as there were last winter, but it's still enough that it is a concern. Here you go. The next thing ahead of it would be heart disease, which comes in at number 7. Here's number 8. Yeah, COVID-19. 121 during this study period. Mind you, the study went from, let's backtrack here, April 2020 up into the fall of 2022. It doesn't include this. I should correct myself. It does not include right now. So it went up to the fall of last year. So we don't actually know how many kids have died in the past couple of weeks. We don't have that data in the study. But to make matters worse, where does COVID rank amongst all people along causes of deaths? Well, number 1 is heart disease with 696,962. Number 2 is cancer with 602,350 deaths per year, or last year. COVID-19, 350,831. That's right. COVID-19 outnumbers accidents, it outnumbers strokes, it outnumbers chronic lower respiratory illness, Alzheimer's, diabetes, influenza, nephritis, if I'm saying that correctly, apologies if I'm not. It's number 3. And this heart disease number, some of those numbers could be inflated higher than normal because we know post-COVID can cause heart issues. I have always long said there should be a long COVID death count. It would be nearly impossible to do, though, because some people don't get tested. They don't know they had COVID. People don't know about getting an antibody test to see if they had COVID. I mean, it's very hard to diagnose long COVID in this country because, heck, we don't even have an accurate count of how many people have long COVID. But some sort of count would be nice, and we could see what is actually stems back to an original COVID infection and what really was heart disease and non-COVID related. But yeah, this is where we stand, and we can take this one step further. Do you really think it's time to end the emergency after seeing that? Well, if you're not convinced, I'm about to convince you now. Look at the life expectancy in the United States. In 2020, or 2019, excuse me, it was 78.79 years old. Now it's down to 77.28. It keeps dropping. All the advances we made over the years, we are starting to lose that. And quite frankly, it's still dropping. Will it go below 75 years old? I don't know, but it's still dropping. It's not dropping as much in Canada. It's not dropping as much in the United Kingdom. It will continue to drop there, but it is dropping much faster here in the United States because we really dropped the ball on this pandemic. You have COVID being a leading cause of death among children, when you have it being the third biggest cause of death among all the population in the United States, that is clearly not the time to end the pandemic emergency. We need the pandemic emergency to stay. We actually need more funding for it. Funding that has a stipulation on it, that has a penalty if it gets used for something else other than the pandemic. We need funding that is set aside for the pandemic only. Not used for the police departments, not used for any other miscellaneous cause, not used for transportation to get your governor around. Yes, it happened in New Jersey. Funding that treats long COVID and finds an accurate cure to stop transmission so we can reverse this trend. Because if we don't reverse this trend, guess what? COVID will eventually maybe go up to the number 2 cause of death, or the second leading cause, and all these other deaths, things that cause death, they're going to increase because of long COVID, and the life expectancy is going to continue to drop. Alright, thanks for watching this video. That's my opinion on ending the emergency. Tell me what yours is down below. Thanks for watching. Remember to hit the like and subscribe button. I'm Data Report for datareport.info.